This month on the Taboo Topics podcast.
Say you have the fungus, you cut your toenails, and then you just lay your clippers up on the counter, and then your husband or your partner walks behind you and they start cutting their nails, and there are spores that are still on the instrumentation, then you can cross-contaminate it like that.
Welcome to Taboo Topics, where host Mary Frances Emmons tackles awkward medical questions with Orlando Health's top health and wellness experts, getting the answers you've been searching the internet to find. Submit your own questions by emailing the letter r-podcast at orlandohealth.com or leave a 5-star rating with your question in the review section. This podcast is produced and sponsored by the healthcare leaders at Orlando Health.
Hello, and welcome to Taboo Topics, where we talk about embarrassing personal health questions and try to take the stigma out of those discussions. I'm your host, Mary Frances Emmons. Today, we're talking about toenail fungus, a highly infectious problem that's not going to go away on its own. My guest today is Dr. Lori Grant. Dr. Grant is a board-certified foot and ankle surgeon with Orlando Health Physician Associates. Thanks for joining us today, Dr. Grant.
Thank you for allowing me to speak about one of these taboo topics. I know a lot of people, they don't like to discuss these things, and so that's what we're here for.
So tell us a little bit about your work with Orlando Health and why this topic is important.
So I have actually been with Orlando Health now for about 11 or 12 years. And so one of the reasons why this is kind of a taboo topic, or why I wanted to discuss it, is because living here in Florida, where we have a hot, humid environment, it honestly is probably one of the most common things that I see in my practice. So it's one of those things that I see quite often. And for some people, it can be rather embarrassing. For others, their husband or their wife makes them come in to have it checked out or have it looked at to see what more can be done. But overall is something that, we do need to discuss, and we do need to kind of get some of the myths uncovered.
So it's kind of interesting that you say people sometimes are urged to come in by their partner, which leads me to ask, how do you know if you have toenail fungus? Is it painful? Is it a visual thing?
So most of the time, it is not painful at all. More than anything, it's a visual thing. The toenail can actually change colors. The toenails can become thicker. They can change shape. And so instead of being like nice and flat on the toenail can actually become a little raised. The definitive diagnosis on how to know you have a fungus is actually with pathology, meaning that we take a sample of the toenail, send it to pathology to see if there is actual fungal spores or fungus growing in the nail. But the number one complaint that I get from patients is that my nail has changed colors, or it just doesn't look normal.
So I understand this is very hard to treat. Is that correct? And why is that?
That is correct. And one of the reasons why it's so hard to treat is because fungus is very stubborn. So the fungus develops what we call spores. And so those spores are hard to kill. And honestly, we don't have the best treatment options. There are, like topical solutions that we can put on, but a lot of those solutions, if the nail is rather thick, then they really don't penetrate very well. So if they don't penetrate the nail, then it can't get to the fungus itself. There's also a pill that you can take, but it can be very harsh on the liver. So we usually try to avoid that if we can, because my kind of joke in the office is, who cares if you have pretty nails if now you have jaundice and your skin is yellow because we've hurt your liver? Yeah, so there's always a trade-off.
So this is also highly contagious, I understand. Is everybody equally susceptible? Are we all passing it around to each other? Or, how does one get it?
Yes, it is contagious, but it's not like if I sit in the same room with you, I'm going to get it. The best way to get it is actually from cross contamination. So you say you have the fungus, you cut your toenails, and then you just lay your clippers up on the counter, and then your husband or your partner walks behind you and they start cutting their nails, and there are spores that are still on the instrumentation, then you can cross contaminate it like that. You can also get it from sharing shoes with each other, meaning if you guys have a pair of house slippers that you just kind of leave by the front door, and if you're going to take the trash out or take the dogs for a walk and you slip those shoes on, and then your partner comes behind you and they slip those same shoes on, sometimes it can be spread that way. Going back to one of the questions that you asked about, is everyone susceptible to it? Not necessarily. I always ask, like my women, for instance, do you have a history of having yeast infections in like the female body parts or like under your breast? And if that answer is yes, then usually they're more susceptible to it because you just have a tendency to produce more yeast or produce more fungus.
More on this after the break.
This episode is brought to you by Orlando Health, the official health and wellness partner of Brightline Orlando. Orlando Health. Choose well.
I've understood also that in addition to people who maybe produce a lot of yeast, which is very interesting, that people with diabetes or psoriasis have to be careful about this, or maybe are they more sensitive to it, or what's the connection there?
So with people like with diabetes and other medical problems, usually the big issue is their immune system is already kind of weakened because of certain medicines you may be taking or just the disease process in general. So they are more susceptible to it. The issue with psoriasis, though, is that you can actually get psoriasis in your toenails. You can get psoriasis, you can get eczema that can cause changes in the toenails that almost are identical to the presentation of fungus. So one of the reasons why we do the pathology, like I mentioned in the beginning, was so we can actually determine, okay, if this is not fungus, now, is it psoriasis or is it some other type of dermatological issue that is manifesting in the nails?
So I've also read that it can start with an injury.
Absolutely. So I always say that toenails are very finicky, if you will. They do not like to be messed with. They do not like to be injured. So anytime you injure the toenail, and it causes a disruption between the nail plate, which is the hard substance that's on top of the nail. If it causes a disruption between that and the skin that it is attached to, then that is a portal for the fungus to jump on board. So honestly, pedicures and or injuries are probably the two most common ways to actually get a fungus.
This is making me think we should all take better care of our toes, because how often do you just drop something, or, I mean, you just don't think about it. You kick it, or then you just go on with your life, whereas if you'd done that to a different body part, you stop and address it.
Absolutely. Yep.
Are there things you can do to prevent this other than, dropping the hammer on your toe? I read about some home remedies, things like Vicks Vapor Rub or apple cider vinegar, tea tree oil. Is there any benefit to any of that?
So yes and no. There's no scientific data that actually supports that those actually treat or kill fungus. I mean, I think we know that vinegar pretty much is the cure-all for everything. Vinegar seems to work with pretty much everything. And I will have to say, in my practice, I have seen some of these things actually work. I like, for example, the Vicks VapoRub. Pretty much all that is menthol. So I'm not convinced that it's actually killing the fungus. I think it is actually just changing the look or the appearance of the toenail, which makes people think, oh, it's getting better because it looks better. Tea tree oil and vinegar both have natural antifungal properties to them. But the big thing about tea tree oil is non-diluted tea tree oil can be very harsh on the skin. So if you use tea tree oil on the toenail, you do need to dilute it just like the vinegar. You need to dilute it with water so it's not so harsh or caustic on the skin.
So, is there anything else that you would want listeners to know about this topic that maybe we haven't talked about yet?
So the only other thing that I want to discuss, sometimes if fungus gets to a certain point where the nail has started to get thicker or is actually causing ingrown toenails, because again, with the fungus changing the shape of the nails, it can actually cause you to start getting ingrowns. So that's when fungus becomes painful. So it's not the fungus itself that is painful. It is the secondary changes to the toenail that can make it uncomfortable. So when a patient comes to see me technically for an ingrown, I have to tell them, well, we need to treat the fungus first because the fungus is causing the ingrown. So sometimes there's a little misconception there. And then also for people, I know we talked about people with diabetes and weakened immune system, but for people that they do not have the greatest circulation, so they have what we call peripheral vascular disease or peripheral arterial disease, where they're not getting enough blood flow to the toes, they have to be extremely careful with fungus. Because if it causes one of those other problems like an ingrown, then that can actually lead to worse outcomes, because then the toenail may not ever actually heal correctly because it's not getting enough blood flow to the area. So I just wanted to make sure that got out there.
So if you do have pain, that's probably a good sign that you need to go see the doctor.
Absolutely. That's, because most people, but for women, you can just put toenail polish on and, you don't have to look at it, but, we can cover it up and keep going. Yes. But for my men, they can put toenail polish on too. Not saying they can't do that. But if it starts to hurt, then yes, it is time to stop your home remedies and seek professional help.
Well, thank you so much for joining us, Dr. Grant. I have learned a great deal. And listeners can learn more about Dr. Grant and her work at orlandohealth.com. And we hope you'll join us again on Taboo Topics, Dr. Grant.
I will be more than happy to. Thank you.
Thank you for listening to Taboo Topics. If you enjoyed this episode, please show your support by sharing with a friend and leaving us a 5-star review. Subscribe today to be sure you never miss an episode. This show is produced and sponsored by the healthcare leaders at Orlando Health. To find a doctor, walk-in clinic, or emergency room near you, visit orlandohealth.com.